Today is May 25th, and this is COVID-19 Local Impact Ottawa Valley. I'm Trevor Riley. Let's take a look at the COVID-19 situation. As of May 25th, we had 20 confirmed cases in the county. We still have 15 resolved cases and still only one death. Total tests in the county have now grown to 3,006, and negative tests are now at 2,813, with 173 tests still to be processed. The Renfrew County Health Unit broke down the results, and they are available at rcdhu.com. And I would like to remind you that the results I'm about to read are for May 25th. The 20 cases break down like this. Arnprior area have 7. Barry's Bay has 1 case. Deep River and area have 1. Petawawa is at 1 as well. Pembroke is at 3. And the Renfrew and area are at 7. Further breakdown of the results, we have 2 cases that are from a long-term care home, 8 are community cases, and 10 are healthcare workers. 4 are in self-isolation. In a press release issued by the health unit, they confirmed a case of COVID-19 at the Riverview Heights retirement residence on Bell Street in Pembroke. They have issued a press release on May 22nd, and it reads as follows. Renfrew County and District Health Unit, or the RCDHU, is confirming that a resident at Riverview Heights Retirement Residence has tested positive for COVID-19. This result was found as part of an RCDHU proactive strategy to identify asymptomatic cases in long-term care and retirement homes. This would be the first positive case in over 2,700 asymptomatic surveillance tests conducted in the past 2 weeks in long-term care and retirement homes in the county of Renfrew and District. Consequently, the result could be an error. To be sure, the original test has been reassessed on May 22nd by the Public Health Lab, and the resident is being retested as well. RCDHU will have further updates within a day or two, but in the interim, the COVID-19 outbreak has been declared and the resident and their contacts have been isolated. RCDHU is working with Riverview Heights to ensure all infected precautions and control measures have been taken to contain any spread. In the province of Ontario, new cases have gone up by 404 cases from the last report. That is a 1.6% increase, bringing the total up to 25,904. 2,102 deaths have been reported, and total tests have increased from the last report by over 8,000, now reaching a total of 619,000 tests. Those are the current numbers for the 10:30 a.m. update on May 25th.
To do this, nonetheless, it's not possible for us. Boxing Ontario and Boxing Canada have suspended all events until further notice, which of course just falls in line with what Premier Doug Ford has done. He has said no events for congregations of more than, I think, 50. And you're certainly not going to have much of a show with fewer than 50 people there.
There have been a lot of commentary across the province on how the Ford government is dealing with this unprecedented pandemic. But how does the province's official opposition feel about the recent decisions and actions made by the Ford government and his team? Your TV Muskoka's James Bowler recently chatted with Ontario NDP leader Andrea Harworth to find out.
You know, there's so many things I do want to ask you. We have a limited amount of time, and some of the things I do want to talk about is, how the Ford government has been doing during this pandemic from the opposition's point of view. There's been quite a few different announcements. There's quite a few different movements happening. Overall, I just want to start out with asking you, what's your general feeling of this government's handling of the COVID-19 pandemic?
Well, I mean, I guess we'll get to a point at some time in the future where we're going to take that hard look and put a scorecard together of where the government did well and where they didn't do so well. At this point in time, what we're still trying to do is identify the gaps and try to encourage the government to take on some things that still need to be addressed. We know that there's been some problems with testing. We know there's been problems with access to PPE. I don't even want to talk. Well, we of course I do want to talk about it, but the horrifying situation in long-term care. All of these things are going to be dealt with and reviewed. I mean, at the early days, Mr. Ford tackled this with a lot of passion. Um, I fear that, I'm disappointed, I guess I should say, that sometimes that passion hasn't translated into the kind of action that should have occurred. So we're just going to keep trying to do our best as an opposition party to stay on the track of making recommendations and suggestions to try to get the government focused on helping people.
Andrea, I think one of the things that I've struggled with, and I know a lot of reporters too, is the mixed messaging from Doug Ford in terms of, what people need to be doing. We are living in cottage country, and I'm sure you're aware of the issues that we've had up here. And a lot of the time, Premier Ford was pushing for people to stay home, not come up, and then that message sort of changed. And then it was a bit of back and forth of, saying don't travel unless essential, but now golf courses are open. So I just want to get your opinion on how that was handled.
Well, I mean, I think you've raised a really important issue. The communications has been probably one of the big problems that this government has had. I mean, we haven't had clear communications. We haven't had decisive direction. There's been a lot of waffling. There's been a lot of back and forth. Even when the very week that this thing all started to come to roost in Ontario, one day the premier's telling people, don't worry about it. Go and enjoy your March break. And then literally within the next day or two, everything shut down. And the advice was exactly the opposite. And so that in itself created confusion, and people ended up going away on vacation. And we saw some of the tragedies that occurred on those cruise ships. And so from day one, really, there has been a real challenge. The government has not been able to communicate clearly, directly, succinctly, or in a way that wasn't confusing people. And I think that's dangerous at a time like this.
What struggles have the NDP been facing as the official opposition of the Ford government? I think the Conservatives in the federal chapter are facing the same issue of not really feeling like they are able to have a voice at this point because COVID-19 is blanketing all the messaging, right? So tell me the challenges you're facing as the opposition of trying to get your message through.
Well, I mean, there's no doubt that the airwaves are quite crowded with starting from more or less first thing in the morning with the roll call, if you will, the Prime Minister and his ministers, and then the federal chief medical officer, and then of course Mr. Ford and our chief medical officer, and then if you're in the GTH area, we get Mr. Tory and their chief medical officer in Toronto. And so what we've been trying to do is we've been very careful not to be silent. We've been working very hard, as I said, to identify the gaps, and our MPPs have been sending all kinds of correspondence to various ministers, and we've been doing what we can to try to really focus on people first as opposed to politics, and try to get what people need out of the government. And that's been our focus. But in terms of the media, it's been for me quite an interesting time. I have a whole new respect for the work that you folks do. I mean, I've always respected the work you do, but I have to say I've become my own makeup person and my own hair person, my own camera person, my own set director, my own producer. Because everything I'm doing is kind of online and through Zoom and through all these different apps and platforms. But that's not a bad thing, because what those things have done is helped me and my team to connect with Ontarians in a different way. And so although the kind of quote unquote mainstream media has been pretty crowded, we've been working really hard. We've been doing digital kitchen table discussions and roundtable conversations, and we've been doing digital town halls and telephone town halls, and we've been connecting with Ontarians in a different way. Probably not as much of a blanket coverage, obviously, as what the Premier and Prime Minister and others are able to achieve. But we're still working really hard to listen to what Ontarians have to say and to try to push forward with suggestions and recommendations and questions for the government on behalf of Ontarians.
Well, and it seems like the messages that you are trying to put out are sometimes punching through. Like, for example, we just chatted about Lisa Gretzky from the Niagara region talking about social assistance, and we had that conversation with her a few weeks ago here on the news program. So, using social media tends to be the best option, and it is still working for you guys as well, it looks like.
Yeah, no, it's been great. So I've been doing this myself, but all of our MPPs have doing that as well, and have been doing that as well. And we have 40 MPPs around the province, literally in every region of the province and every type of community. We have MPPs that represent rural Ontario, urban Ontario, northern, southwestern, eastern Ontario, central Ontario. We have MPPs everywhere, and so they're able to do this kind of connecting in their own communities as well. And so although we're not getting as I said, the same kind of reach, I think in some ways we're connecting more on almost on a grassroots level, if you will, with a lot of Ontarians around the province.
Stay tuned for tomorrow's episode of COVID-19 Local Impact to hear the NDP leader's thoughts on a recent decision made on education and the Ford government's move to shut down an inquiry into long-term care homes. I'm Trevor Riley. Thanks for watching.